How do the enlarged tonsils contribute to snoring and sleep problems in children?
Yeah, so tonsil, these days when I'm talking to patients about tonsils, it's usually about sleeping. A long time ago, it used to be about recurrent tonsillitis, which we do still see patients for recurrent tonsillitis, but these days it's more about sleep. So kiddos will have loud snoring where they're rocking the house, that parents may have witnessed them, choke or stop breathing. And on exam, we look in the back of their throat and those tonsils are huge. They're completely touching. And so the tonsils, which sit at the back of the throat, and the adenoids, which are tonsil-like tissue that's in the back of the nose, they both can contribute to airway obstruction and snoring because they're sitting right in the airway. They're sitting along the path of where air is coming in and going out. So they create snoring, which is just the turbulent sound of air flowing. But more worrisome, they can create obstruction and cause problems with sleep.
What symptoms should a parent watch for that suggest snoring might be a sign of sleep apnea?
This is an important point because snoring by itself is not dangerous. Snoring plus obstructive sleep apnea is a problem that we need to address. And so a lot of times parents will come in because they've heard their child sleeping, and it's not only is it loud, noisy snoring, but there may be pauses, gasps, apnea, which is a period where the child is not breathing. All of that is concerning for obstructive sleep apnea. Daytime symptoms might be irritability, hyperactivity, behavior problems at school where the teacher might be, calling you and saying, hey, we're having some issues. Sometimes there might be bedwetting. And so all of those might be signs that this is more than just snoring and we may need to look into this.
When is a surgery like tonsillectomy is recommended for children with snoring or sleep disordered breathing?
So if a child has a diagnosis of obstructive sleep apnea, meaning if they've had a sleep study that shows there is obstructive sleep apnea, we will be talking about tonsillectomy and adenoidectomy because that surgery is extremely effective for treating obstructive sleep apnea, what we call OSA. A lot of children, when they come into clinic for the first time, they haven't had a sleep study, obviously. And so we're going based on what I'm seeing on exam. So I'm looking at the tonsils through the mouth. I'm watching the child to see if they're mouth breathing or if they're able to breathe through their nose. And then I'm listening to the parents tell me kind of what symptoms, what's been going on. If the suspicion for sleep apnea and the exam match up, so for example, if a parent is telling me that there's a lot of snoring, a lot of pausing and gasping and choking, and then I look on exam and there's no room for air to move because the tonsils are so huge that they're touching in the middle, then we say, yes, that makes sense. We can go ahead and proceed to surgery. We can skip the sleep study because we know that this child is having a problem. If there's a question, sometimes we might move to a sleep study to help us make that decision.
What is the recovery like after a tonsillectomy, and how soon the kid usually notice improvement in their sleep?
Yeah, recovery for kiddos is a lot easier than for adults who are getting tonsillectomy. Kids usually bounce back pretty quickly, but I will counsel families that they can expect a sore throat for a couple of weeks. We like to keep kids on a softer diet for that time just to allow the areas to heal. Some families will tell me that the sleep is better instantly. Sometimes there can be some swelling, and so we might say, give it 3 or 4 weeks before we have a good sense of how well the surgery has worked. I usually will have kids on light activity for a couple of weeks, even though that can be challenging, especially for the little ones who are excited to get back to recess. But as much as possible, we like to give them time to rest and recover and heal.
How expensive is it? Especially knowing that we serve TPA, self-funded captives, and people with high deductible insurance and people with no insurance.
Yeah, I think, for me, it's always exciting to be able to offer the bundled surgery option for patients who are struggling to figure out how they're going to pay for their child's surgery, which is really heartbreaking that families are having to kind of make that decision for how things are going to how they're going to make the math work for doing what the surgery that they need for their child, but also kind of taking care of, the rest of life. And so it's always great to be able to bring this forward as an option that's affordable, where patients can take care of their child, but also, not break the bank.